Good morning, everyone. Welcome to the meeting here today at ABC Medical Center. Today I'm going to introduce you to the new comprehensive EHR system. I know right about now you're asking yourself, what is an EHR system? So let me explain to you what the system is about. What is an electronic health record? Here's the basics. An electronic health record is a digital version of a patient's paper chart. EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users. While an EHR does not contain the medical and treatment histories of patients, an EHR system is built to go beyond standard clinical data collected in a provider's office and can be inclusive of a broader view of a patient's care. EHRs can contain a patient's medical history, diagnosis, medications, treatment plans, immunization dates, allergies, radiology images, and laboratory and test results. They can also allow access to evidence-based tools that providers can use to make decisions about a patient's care. They can also automate and streamline providers' workflow. One of the key features of an EHR is that health information can be created and managed by authorized providers in a digital format capable of being shared with other providers across more than one healthcare organization. EHRs are built to share information with other healthcare providers and organizations, such as laboratories, specialists, medical imaging facilities, pharmacies, emergency rooms, and school and workplaces. So they contain information from all clinicians involved in a patient's care. Let me give you an example of a real case. This is my friend Rondi, and he has been through the mill with his hospital visits this last year, so I'd like him to talk a little bit about his experience and what he had to go through as far as explaining his situation and how frustrating that was because there was no EHR.
You know, I have Lyme disease and I have mycoplasma, which is chronic pneumonia. It's a bacteria without a cell wall. And for the last 3 years, I've been hospitalized. And I go into sepsis, end up in organ failure, ICU. So every year I've spent 5 to 7 days in ICU to get through it. And what's frustrating about it is it never seems to happen at the same hospital. You know,
Right.
One year I'm in Lake Tahoe, the next year I'm in San Diego, the next year I'm in Las Vegas. So this year I was actually hospitalized for 7 days at Rose, and then they discharged me within like 3 hours. I was back at Mountain View. And the problem with it was I'm sick, literally dying, and I'm trying to explain to the doctor what's wrong with me.
Yeah, that's...
And if they had EHR, they could have just pulled it up with Rose, or they could pull up Reno or Tahoe or San Diego and seen what was actually going on with my medical history without doing all the tests and the poking, the prodding, and the wastefulness of days trying to figure out what's wrong with me. And they rely on the patient to explain what's wrong. And with EHR, the patient doesn't have to explain anything. They literally pull up the records, they see what's wrong, why you've been hospitalized, what's wrong with you, what you're on, what tests have been done, and then you can move forward and make it a better experience for the patient and more effective.
Exactly. That's the whole point of EHR.
Yeah, exactly.
Yeah.
That's
Thank
what
you,
it's for.
Rondi. Absolutely. I know we had talked also that you said like you had, when you were in the hospital, like you had 8 HIV
Had
tests
8 HIV tests.
in the same hospital?
How about the first one? The second one? 8 HIV tests at Mountain View Medical here in Las Vegas. Because the doctors weren't communicating to the other doctors. And they were putting it on their paper chart, but when the new doctor would come in, because it's a student educational college or educational hospital. Mm-hmm. So what was happening is one doctor would show up in the morning, test me for HIV, and then he'd leave, and the doctor would show up at noon, was test you for HIV, because I'm looking at your white blood cells and your CD57 and your T cells. It looks like you have full-blown AIDS, so let's test you for this. Because the morning student hadn't turned it in, so it wasn't in the computer yet. It was still on his charts. So 8 tests.
Unbelievable. I would have been upset.
They actually did over 500 tests on me.
Unbelievable.
Just I'm not going to say they're garbage tests or BS tests. They were doing the best they could do, but because they didn't have it in one place and they were looking all of these other places, they were just duplicating the tests. And what's bad about that is the hospital spending the money, they're billing the patient, or they're billing the insurance company. The insurance is not going to pay for the 8 HIV tests. I didn't know I had 8 HIV tests. I found out about it later because I got a letter from the insurance company saying, hey, we're not going to pay for 8, we'll pay for 1. And so now the hospital's spending all this money and time and effort doing this, where if they had EHR, they'd do one test and be done with it.
Right.
Right? Because they're losing money because the insurance company's not going to pay for it. I'm not going to pay for it.
Exactly.
So they just lose money on it and resources and time and all this stuff.
Yeah. Well, thank you, Randy. Thanks
bet.
for that. Thanks for that. That was awesome. EHRs and the ability to exchange health information electronically can help you to provide higher quality and safer care for patients while creating tangible enhancements for your organization, which is what you were kind of just saying, you know? So EHRs help providers better manage care for patients and provide better health care by providing accurate, up-to-date, and complete information about patients at the point of care, enabling quick access to patient records for more coordinated, efficient care, securely sharing electronic information and patients and other clinicians, helping providers more efficiently diagnose patients, reduce medical errors, and provide safer care. Also improving patient and provider interaction and communication as well as healthcare convenience. It also helps with enabling safer, more reliable prescribing and helping promote legible, complete documentation and accurate, streamlined coding and billing. Enhancing privacy and security of patient data, helping providers improve productivity and work-life balance, enabling providers to improve efficiency and meet their business goals. It also reduces costs through decreased paperwork, improved safety, reduced duplication of testing, and improved health.
That's exactly what would help with me.
Right.
Like that line right there.
Right.
That one sentence could literally save hospitals
Millions.
tens of millions of dollars every year.
Right. So also now patients can download a phone app to enhance the EHR system. It's called a mobile EHR on iOS and Android devices. It represents one of the major growth areas in the EHR market and has been documented as an effective way to improve practice efficiency. So accessing an EHR via tablet computers can decrease the total time physicians spend logged into workstations while on duty. Improve the efficiency of inpatient medical care by facilitating earlier order entry and decrease inpatient data management time while increasing the time physicians spend interacting directly with the patients.
When I went to the doctor, can you imagine if I just pulled out my phone and said, here's what's wrong with me.
Man, that would
Here's my records.
Could you imagine? That would be awesome.
And then it's like, oh, let's skip all the rest of this BS
Yeah,
and let's just get to the point. Let's focus on what's wrong with you right now.
exactly.
Yeah, this is awesome.
Yeah. So further mobile devices can use in the clinical setting can result in qualitative gains through improved documentation, medical decision making, and physician efficiency. As such, EHR vendors have shifted their focus to prospects of mobile technology adoption by practices. So you want to ask, what are the benefits of mobile EHR? Once implemented, mobile EHR apps offer numerous benefits for your workforce. These include quicker and more accurate documentation. The longer the time between the patient encounter and the time the visit note is written, the more likely small but important details will be omitted, which can have an effect on the patient well-being and also jeopardize potential insurance payouts. Mobile EHR apps allow your healthcare providers to take notes as the patient encounter is unfolded, which reduces margin for error and frees up time that would have spent documenting the encounter later on. A more informed workforce, your clinicians are busy and it's easy for small tasks to slip under the radar. Mobile EHR offers the possibility of automated tracking alerts for things like yearly tests, like for you,
Yep.
and normative values for lab findings and push notifications to alert. A more effective revenue stream also with mobile EHR providers can input their billing at the point of patient encounter. This greatly increases timeliness in billing, which results in faster reimbursement from payers. In turn, this ensures that the revenue streams remain constant so that your practice can operate as efficiently as possible and provide top quality patient care. So this is why we're moving to an EHR system, not only for its cost effectiveness and our improving ability to better serve our patients, but think about it. We start making the patients happy and they are spending less time in the hospital and have a much lower bill. We will likely start getting great reviews on Yelp and Facebook and many other means of social media. Thank you everyone for coming in today. I would love to hear your feedback. Thank you, Rondi.
Thank you so much. Can't wait to see the EHR system applied to your hospital.
I expect to see that app on your phone right away.
Yes,
Okay.
for sure. Let me download it right now.
All right. Thank you, sir.